to Chamber Chat. I'm Stephanie Ford. This week we are chatting with Dr. Corsten from AdventHealth, and I'm going to let him introduce himself and his specialty because I've tried to say it and I mess it up every time. So welcome.
Hi, thank you, Stephanie. Martin Corsten. Yeah, my specialty is otolaryngology, head and neck surgery.
So tell us a little bit more about that, that specialty, head and neck cancer. What exactly are you working with?
So the most common cancers of the head and neck, I would say, there's probably four. The first is cancers of the oral cavity, such as the tongue or underneath the tongue in the mouth. Cancers of the voice box or larynx are still quite common. And then another thing we deal with very commonly is thyroid cancer, which is another cancer that's been increasing in frequency over the last couple of decades.
And what are some of the causes behind these?
The main causes for head and neck cancer are really two. The first is smoking. So for years, smoking was the main cause of our cancer population, and it would be almost rare for me to see a cancer in a non-smoker. Still, that is commonly the cause for oral cancer and for cancer of the voice box.
Wow.
But the rates, of course, of smoking have decreased, so have the rates of those cancers. The cause of tonsil cancer and cancer in the back of the tongue is actually a virus called human papillomavirus. So this is almost ubiquitous. In other words, everybody's exposed to it. Sexually transmitted virus, so every American almost is exposed to that virus. The majority of people are exposed to it but then clear it. About 10% of men and maybe about 5 or 6% of women don't clear that virus. It remains in their saliva and it can cause cancer later on in life.
Interesting. And are you seeing cancer from other forms of like vaping or smoking? Is that included in smoking?
Yeah, I think more than vaping, I would say we see it from smokeless tobacco. So putting the tobacco in the mouth, especially when they have it up against one part of their mouth all the time, we'll often see cancers right there.
Interesting.
I don't know about vaping so much. I think it certainly seems to be less common with vaping, but of course vaping hasn't been around long enough for us to really do the...
Right, yeah, I was curious if you had information or studies on that, yet. How do you pre-scan, or how do you find out if you potentially could have neck or throat or head cancer?
Yeah, so I think there's a couple of things that are really important in terms of screening for those cancers, and one of them is actually going to your dentist. So your dentist does a great job at examining the entire oral cavity. They'll look under your tongue, they'll look at your tonsils, and also most dentists have a feel of your neck as well. A lot of these cancers show up as an enlarged mass in the neck. So we did a study which looked at the frequency at which people went to their dentist and how early those cancers were detected. And certainly people who went to the dentist the most frequently had these cancers detected early.
Gotcha.
Second thing to do is to go to your family doctor with any one of a number of symptoms. Certainly a new neck mass is a common one, a sore or a canker in the mouth that doesn't heal, and then new symptoms such as coughing up blood or a severe pain in the throat that just doesn't go away and gets worse and worse. These are things that would mean you should come into the family doctor, and the family doctor would often send folks to one of my colleagues who are otolaryngologists, ear, nose, and throat surgeons, and eventually once we figured out it's a cancer, they would come to a specialist like me.
Gotcha. And you mentioned thyroid cancer. If someone had thyroid disease, are they at risk for that, or is that could be a separate thing?
It's usually unrelated. So thyroid disease like hyper or hypothyroidism, often that doesn't have any relationship with thyroid cancer. Thyroid cancer, usually people will have thyroid nodules. Thyroid nodules, by the way, are extremely common. Probably about 50% of women have a thyroid nodule if we look for one. But it's our job to sift through all those ones that are likely benign and find the ones that might be malignant.
Tell us about any new programs you have coming out and what areas you serve.
So I do want to mention, we're starting a head and neck program, or just have started, at AdventHealth Daytona, myself and my partner, Dr. Matt Biskup. And we're basically joining an already established head and neck cancer program that already has 3 sites in the Orlando area. So we've opened Daytona as the 4th site of this larger program. But it's exciting for the patients around this whole east coast of Florida area, because folks were going up to Jacksonville or over to Orlando for treatment, and anybody who's been on Highway 4 knows that can be a bit of a trek. So we're building that program here, and it's already been extremely busy. We can tell there's been a real need for it. One of the things we do, and one of the innovations we brought to AdventHealth Daytona, is using robotic surgery to treat tonsil cancer.
Wow.
So these cancers are usually treated with either surgery, radiation, or a combination of both. For the tonsil, we can often take out the tumor with the Da Vinci robot, and in many cases we can allow the patient to avoid getting radiation therapy afterwards, which is really beneficial. We can only use radiation for cancer one time in a patient's life, usually in the same area. So if we can keep that in our back pocket as a weapon to use against a future cancer or a recurrence, that's a great thing. So the robotic surgery is something that, of course, was being done at Advent Daytona for other specialties, but we brought it here from a head and neck cancer point of view, and we're using the Da Vinci robot for that.
That's great. And you'll have an opportunity to see that robot firsthand at a membership breakfast that Advent is sponsoring later in the year. So be sure to check our calendar of events for that, and to come see that robot live in person. It's very cool. Thank you so much for joining us, and a special thank you to Shark City Media for producing this content.